Let me ask you this, Mike, real quick. Can we circle back to Duke? What did you have done while you were there? Was it an experimental type of a thing, or was it traditional chemo, radiation? What was your process, if you don't mind sharing that with us?
Sure. Well, what I did is again, just to kind of summarize, I had what was called major resectional surgery here at Scripps. I had two surgeons who basically cut out my entire sigmoid and a third of my rectum, stapled me together. I had a month of recovery time, and then I began chemo, where I have a port. The port is since removed, but I got a big old scar here. They put in a port, and then I carried around, and I had FU5 and I can't remember the other. It's a mixture of two horrible chemicals that make you miserable, but it's designed, of course, to shrink and kill any remaining crud inside my body. They did find two lymph nodes. They cut out 48 lymph nodes when they did the surgery. Two of them were cancerous. That's why we continued with the additional stuff. So I had 4 months of chemo, injectable chemo, which involved basically carrying around like it was like a fanny pack that had a tube that went up to my port.
Did you just move out to Duke for that whole 4 months, or were you traveling back and forth, or how was that?
So that 4 months was here in San Diego. And then I had about a week and a half gap where I actually went, and it's amazing I could do this because I had so little strength, but I actually went to the Bahamas for about a week with my wife. Then from there flew directly to Duke, and I was there for about 2 months. And I had 33 radiation treatments, and I took oral chemo while I was there. So I had daily oral chemo. And so I took pills twice a day. And then once a day I went in at about 10 or 11 in the morning. So, I mean, the day was essentially get up, clean myself, use the toilet God knows how many times, jump into a car. I stayed at the equivalent of a Ronald McDonald house while I was there. I didn't stay at the hospital, but it's like basically a little private room in a community home with other people who are going through cancer. And really, I just slept most of the time or laid around because I just didn't have any energy.
Sure.
But I'd get up, take a shower, jump into the car, basically use the bathroom as many times until they'd admit me, put on a little thing. I'd walk bare butt naked into this room, lay down on a slab, smush my junk into a lead-lined pan, and then they had tape all over me where they had like X's and O's and stuff where they'd line me up with some lasers and then zap my nether regions with the laser where I'm, my butt's facing straight up. And I got to tell you,
one of your most glorious moments, no doubt, right?
Here's the deal. Here's the great news is it doesn't take long and you realize I can have no shame. It's just a body. They've seen a lot of other bodies and you get past the whole thing because they were actually, the nurses there were very funny, and I always walked in with a smile on my face. It was like I made the most of it, and every day I had a butt joke for them. But I mean, it was like I walked in and I wore my cowboy boots and this bare butt smock, so I'm laying down and they'd zap me for a little while. I'd get up, use the bathroom a couple more times, jump in my car, usually stop by. There was a Whole Foods nearby so I could get some decent food. And, and trust me, I wasn't hungry most of the time, but man, I drank 1.5 gallons of water a day, and I ate because I knew I needed to stay alive. But I walked out of there. My normal weight's about 185, 190 pounds. By the time I was done, I weighed 158 pounds, and I looked like a Auschwitz victim. My hair, I lost about 2/3 of my hair, and it was all gray. And, I see videos or pictures of myself now, and I'm like, oh, who is that guy, man?
Yeah, it's not almost like it wasn't even the same person. I remember when you first came back and kind of made your first public appearance after that. And even then, we knew that you'd kind of already been to hell and back. And, and we saw, it was like, wow, he definitely lost a lot of weight and this and that. So there's the weight loss aspect of it, I guess, is good to a degree, right? But
we call it the cancer diet.
The cancer diet. There you go.
You can do the divorce diet, the depression diet, the debt diet. But yeah, keep on going.
Right. So okay. So now you finished up your treatment. You come back home. Now you're kind of recovering from the chemo and the radiation and all that kind of stuff. How did you handle, or how did your team handle all the aftercare? That's a really important part of this, especially for those who are traveling for their care. How did that all work out?
Well, the great news is it was so easy. To this day, I email my doctor at Duke all the time. I have check-ins with Dr. Nalini every other week. Talk to her every Monday, and she talks about what's going on. She adjusts my supplementation intake, my diet. I've got tonics that I take, some herbs, some Chinese herbs. So I'm doing integrative work. I email and talk to my oncologist and my surgeon I see regularly. So all of them work as a team. I make them aware of what everyone is doing, but it's up to me to capture the data and communicate it. You can't rely on them to talk amongst themselves because, again, they're all busy and it's hard to make those schedules. So I found that I collect the data and I report to all of them and I help them communicate and connect. But the key thing is, it's my opinion that aftercare, no matter where you are, is easy, but you've got to take charge and take responsibility for your life and your health, again, so you can serve your family and yourself and your community effectively. But I think that, again, the most important thing is when you come back, make sure that you are clear with a path for your nutrition, your supplementation, your aftercare. And again, I cannot recommend highly enough a regular meditation practice, regular acupuncture, and also seeing a nutritionist who actually can communicate with your oncologist and your doctor. And you got to just make sure if there's a lot of resistance and pushback, it's probably for a reason, you know, because you hear this all the time. It's like my doctor this and my doctor that. And it's partially because, you know, sometimes they're a bunch of old fogies and craggly, old straggly guys or gals. But, you know, it's something that I definitely...
Oh, we lost the beach in the background.
Yeah,
there.
I just fixed that for you.
There we go.
So it's something that you've got to just take responsibility for and take care of you and integrate. I think that's the deal is at this point in time, physicists as well as theologians all know that we are a combination of physical, spiritual, emotional, and intellectual beings, and all of those have to be integrated if you are going to be healthy. And I would also say that, yeah, sometimes we're born with some bum DNA or we inherit some sort of tendency towards something, but we can, for the most part, control the environment we're in and what we put inside our bodies, and life doesn't happen to you without your permission. So you have to take responsibility for your emotional health as well. And I happen to be of the belief that many diseases are, in fact, physical manifestations of an emotional challenge. And generally speaking, it's rigidity, an inability to feel fully, and it's turning and cutting yourself off from emotions. And those emotions stop up. And tumors can, in fact, be a manifestation of an emotional block of some nature. And that might sound a little woo-woo, but I guarantee you it won't be long, and pretty much every doctor will say, you know what? Probably true. Or there's just going to be hard proof of it, and there's quite a bit of it already. So
sure,
again,
and I mean, as you're a high-profile individual yourself, you know, and you do lots of, you know, live broadcasts and interviews and a lot of different things, and you know, I mean, I can certainly see where the pressure of that on a day-to-day basis can get you to that point. And then you've got business decisions, and, you know, hey, let's face it, as entrepreneurs, not everything goes perfect all the time, and there are stresses and this and that. And, you know, I think like what you're talking about, being able to kind of set that aside, have a good positive attitude about it, and let it not manifest itself, I think is probably wise advice. If nothing else, keeping your stress levels down is going to be important for you. So. Yeah, absolutely. Yeah. Well, let me ask you this, Mike. One of the questions that we ask all of our guests on the show is something that you actually kind of alluded to earlier, which is great. So if someone came to you and said, hey, I'm thinking of doing this, and let's say that someone was your wife or your child. Okay, we ask this of everybody. So somebody that you're related to came to you and said, what would you recommend? So we ask this of our doctors, of our healthcare experts, and of our patients that we talk to. What would be the top 2 or 3 things that you recommend? And we've talked about some of those things, but, you know, really dig down and tell me, what do you think the top 2 or 3 questions that you think need to get asked of that healthcare professional or doctor or facility before you would feel confident that they were making the right decision for them and making a safe decision for them?
Well, I kind of went through my top 5 the way I asked the questions right from the beginning, right? So I'm going to just say that's the first thing, is asking the questions. The next thing that you have to ask is specifically, how many people like me who have had my specific diagnosis have you treated, and what have the outcomes been, and what have the treatments been like? And speak in specifics, okay?
Yeah.
Because generals don't matter, okay?
Mm-hmm.
And if this individual you're speaking to hasn't treated plenty of people with your specific thing, find someone else. Do not be someone's experiment, okay? Guinea pigs are for rodents, not for human beings, okay?
Right.
Or guinea pig treatments or whatever.
Right, right.
Don't be someone else's science experiment. Unless you're okay with that. And again, you know, sometimes if you're in dire straits and you're stage 4 plus and you got no other options and the clock is ticking, by all means, you just got to follow your instincts at some point. The other one is something that I did, and this is, again, if you're an adult and you're surrounded with people who like to give you advice, I actually wrote a letter that I sent out to everyone who I cared about, and I explained specifically what I had and specifically what I planned on doing and how they could help me, because everyone's going to reach out to you, and what you'll find is you simply cannot manage just your own internal state in your family, and you got all this noise and everyone wants to help you out. By trying to help you, they actually wear you down. So what I did is I said, look, I've made a decision on how I am going to be treated, and if you have any recommendations or suggestions that you'd like to give to me, there is only one way I will accept this information. Please do not send me an email filled with links. I do not have a staff who can sift through all this minutia and give me advice, okay? So if it's important and valuable, I would like you to cite what it is, if it's applied directly to my diagnosis, and I told him exactly what my diagnosis was, how, you know, if there are any clinical, if there's clinical data to support that, and if it's recognized by the medical establishment. And I went through, basically I created a whole bunch of roadblocks, and I said, here is my P.O. box and my address, print it out, put it in this format, and it needs to meet these criteria for me to examine it. If you have a book that you'd recommend, mail it to me along with the invoice, and I'll pay you back for it, okay?
Sure.
The whole point is, what it did is it filtered out 99% of all the crap. So all I had to do is deal with people who really cared, who were really willing to put forth the effort. Because everyone's got advice, and everyone's got an opinion and a recommendation. You'll find out most of it is garbage that they, you know, it's like they read it in a People magazine or Us magazine, and you don't want your life hinging on some sort of hearsay. And like I said, it filtered out all the crap. I ended up having real people who did mail me thoughtful, practical advice, some of which I was able to integrate.
Oh, good.
But like I said, the other thing I did is I set up a phone number with a voicemail that they could leave their message for me that I could listen to.
Using your own technology. I love that.
Yeah.
Absolutely.
Yep. So that was effective as well. And I still have the database of all the calls. And I made business cards. And people would come up to me and walk up. They had all this advice. I'd love to hear it. Here is a card. Please call this number. And I explain specifically how to communicate this, because otherwise I'm going to lose all this incredibly valuable information that you want to give to me. And really, it sent them that document with, here are my rules to tell me what you want to tell me. And again, a lot of people have advice, but very few people are willing to actually work to provide good advice.
Well, dude, I'll tell you what, I mean, that's fantastic advice you're giving us. I really appreciate that. And I'll tell you what, let's wrap it up with this then. How can people reach you or find you if they want to ask you more questions or find out more about who you are and your entrepreneurial journey? I mean, Mike Koenigs is a best-selling author. He's a movie producer, a lover of Teslas. How's your new Tesla, by the way?
It is a dream. It's the finest piece of equipment I own. You know, it is the best car ever made, and the reports support that, and so does the feedback that the company's getting. It's safe and fast and quiet, and
Yeah, I got a picture in front of Bumblebee, your old, the Tesla Roadster that you used to have. It was one of only 25 carbon fiber yellow models, and I happened to be out there for one of the events, and I have that on some of my social media. It's just a great car. My kids are like, Daddy, when are you going to get one of those? I'm like, well, I'm working on it, honey. I'm working on it. So, Okay, so how can people reach you, Mike? How would you like people to contact you?
Well, there's a couple ways. One is I have a website, which is my name. It's MikeKoenigs.com, MikeKoenigs.com. Also, my Facebook page, it's just facebook.com/KOENIGS.
Mm-hmm.
You can send me a private message if you'd like, and either myself or my assistant will see that. And then, you can search me online, watch videos. I've been planning on doing this. I wanted to wait until I got past right where I am right now. I will be writing a book on the topic and subject of surviving cancer as an entrepreneur, because it turns out that I didn't find much support at all on how to manage and run my internal and my external world as an entrepreneur, nor was it easy to find advice. So
yeah, I'll tell you, let me interrupt you just for a second there, too. If I can throw a shout out here for those of you who are in the audience who are business owners yourself and entrepreneurs and are minded that way, Mike was really fortunate in that he happened to, through serendipity or whatever you want to call it, run across Ed Rush. Ed is a fellow Marine like myself, and the timing of it all just worked out. And basically, you were able to get to the point where you knew, like, and trusted Ed and had worked with Ed enough. And he was one of your customers and had done some great things with your software and gotten to the point where he was working with you anyway. And you basically said, look, dude, I've got this life challenge and I need to hand this over to you so that I can conquer this mountain first, and then I'll come back and we'll conquer the world together. And I love the way you went out and did that. And Ed's just a really stand-up guy, and I really wanted to throw a shout out to him as well for helping you to make that transition. And for those of us who were customers of the company and the software that we use and all the great products that you guys have to help with using social media and promoting and consulting and everything else, it was just fantastic. So it might be a shameless plug, call it whatever you want, but I mean, for me, genuinely, I have known you now for 5 years, love using your stuff. I'm a best-selling author because of you. I'm sitting here doing this podcast. We're in 42 countries on a bunch of different platforms, thousands of downloads. I mean, all of this is because of the stuff that you helped us and brought us up through. So you've given me a platform. I really appreciate that, and I just wanted to, again, publicly thank you for everything that you've done for Jennifer and I. And Jennifer couldn't be here, unfortunately, my wife, but she wanted to express the same thing. And as a fellow cancer survivor, she wanted to also, basically say, hey, welcome to the club of survivors. You weren't supposed to make it, and yet you said, nah, I'm not. I've got too much to do before I leave.
It ain't bringing me down, not yet. Yeah. So, well, thank you for that, and I'll tell you that it's because of you and the community that I chose to live. I get to be who I am because I get to serve. And that's what ultimately drives me and gives me immense joy. So thank you for that. That's very kind. And what I will tell you is being able to find a supportive community and be willing and able to ask for help is how you survive and survive better. And more importantly, how you thrive, because survival is just part of that. But again, no one wants to just survive. If that's if it's either be dead or survive, well, then I guess survival's better. But you want to be thriving, and that means thriving as a emotionally whole person who's surrounded with people who love and trust you and want you to be your very, very finest self. And thankfully, like you said, Ed was there when I said I was diagnosed with cancer. He's the first one because he was in a mastermind group here in San Diego. He just raised his hand. He said, I'm in the process of shutting down one of my businesses, and I'll come in and I will be you. And he became my voice while I was going through this, as well as the rest of my team stepped up and they took charge and did what needed to be done. And that really was an incredible, incredible gift. And again, it just gave me that additional strength I needed when I just didn't have myself any longer. Just knowing that everything was going to be okay. My son was going to be okay. My wife was going to be okay. My community was going to be okay. And as entrepreneurs, we get our identities wrapped up in being able to make money and to provide and maintain an illusion that everything's okay. And when I could just honestly say everything isn't okay, I am genuinely wrestling with life and death right now. But and I didn't tell everyone right away of my diagnosis until I was in it, and I had to think about how I could communicate it with integrity and also with fearlessness and courage. And I was afraid that if my community found out that I was dealing with a death situation, that they'd abandon me. That was what I was afraid of, and I believe that part of what contributed to my diagnosis and the disease in the first place was an enormous amount of anger and rage and emotional denial for many, many years, in addition to what amounted to be some unhealthy eating habits and some genetic predispositions. So
sure.
It's just like, it's a combination of things. It's never just like this one thing, and there is no one answer, right? It's a combination. We are whole beings we're in a complicated environment and world. And again, it comes down to being in a community that can be there with and for you, and know that it's a team effort to survive and to live and to thrive.
Absolutely. And Mike, we really appreciate you kind of sharing from the heart. This is really, I know in our community anyway, I think this is the most you've really talked about this, and I really appreciate you sharing this with our listeners. Before I forget too, I would be remiss if I did not mention your lovely wife Vivian. She has a fantastic foundation, and I would love to give you an opportunity for a minute or two, or in a couple of minutes, to kind of talk about that and give everyone the link, because what you're doing and what she's doing over in Africa is really changing lives and helping on a global, they're trying to make global scale change. And I admire the fact that, Mike's stated goal is he wants to create 1 million entrepreneurs, 1 million millionaires in his lifetime. And part of that is to helping other impoverished areas, including women and young girls in Africa. So why don't you talk about that a little bit?
Sure. Well, here's the quick plug. It turns out, as of now, when we're recording this, 2 days from now, this Friday, she is actually leaving for Africa. It'll be her 18th visit. My wife's her parents are Holocaust survivors, so she has no living relatives due to a Holocaust. And when she saw what was going on in Africa, she says, I can't stand to let another one occur while I'm standing here in a privileged environment. And there's some other things that led up to that. So what she's been doing for the past 7 years is raising money. This is actually her 8th year, raising money, building schools, hospitals, providing healthcare, nutrition, microfinance programs, and now mostly girls empowerment and justice programs. Why girls and why Africa? The reason is because if you think about it, a small shift of power, a small subtle shift over there. If you just help a woman start a business, they can send their children to school, and that's usually what women do over there. And when their children go to school, they don't get pregnant so early, and they don't end up getting diseased or married off when they're 12 or 13 years old, and then either creating more diseased children or more poor children who are ignorant and uneducated, who can't provide for themselves, and the cycle continues. But inside of a couple years, by giving a woman the ability to make some money, whether it's by raising some goats or some chickens, being able to sell that, have some healthy, nutritious food, send their children to school, prevent those girls, if they can get to the point of being 16 or 17 without being pregnant, the cycle stops. And the tyranny that occurs over there to young girls who are treated as objects and as animals, essentially, stops as well.
Sure.
So the bottom line is her vision, her mission is to empower 1 million girls. And the hope is, and like Bono said this before, and many great people over there, the investment of providing some support and some hope can prevent what amounts to be terrorism coming over onto our shores.
Sure.
And an investment over there, if we just create one leader who can be the next Mother Teresa or a great educator or a great leader in an African country, can create peace and harmony for most of the planet. And it would be a darn good investment. So
you get a lot more bang for your buck over there too. Let's face it.
It's amazing what $100 will buy you. It's the truth.
Absolutely.
So over here, you're criminalized for doing good work in this United States with the way our tax system is set up and the way the 501c3s are treated. Over there, you can go over there and do really good work for very little money, and literally save hundreds, thousands, or tens of thousands of people. And again, we all benefit from that in the long haul.
Absolutely.
And I think that's really what the game's all about. I'll take care of the developing or developed world. She can take care of the developing world. And it's easy for all of us to participate in the vision and the dream too.
Sure. Excellent. And how can people get in touch with the foundation?
It is justlikeMychild.org. And there's great videos on there. There's events that take place. And you can really learn about the outreach program, and she's got a very powerful philosophy, and she's actually essentially created a product. She calls it Girl Power in a Box, that is delivering this training and education where they're actually teaching girls how to become teachers. And that's how
excellent.
It's really 100 times 100 times 100 will reach 1 million girls. So
yeah.
They've already trained thousands of girls with this program, and that's the next step, is not just to keep it in Africa, but actually hit the rest of the world as well. But they started a place where it was simple and easy without a lot of government intervention. That's one time when having a small government that is ineffective actually works to your advantage. But
hey, that's the power of exponential thinking, right? You know, you've interviewed Peter Diamandis before, and Abundance, and that's one of my favorite books. And you guys are living that, and a living testimony to the fact that you're going out and making these changes and helping to change the world in such a way. So, you know, Mike Koenigs is not only, you know, a cancer survivor, great dad, great husband, you know, and doing all these great things for his entrepreneurial community, but he's also not just in it for the profit in and of itself. You have grander goals and things that you're trying to do that will help engage the world. And I mean, I respect that and admire that, and I thank you very much for, you know, helping me and Jennifer to get where we are today, and for coming on the show. Really appreciate it. So thanks again, Mike.
Thank you. Well, you owe it to yourself to become as wealthy as you can, to change as many lives as possible and impact as many lives as possible. And after all, you can only spend so much, realistically, you know, unless you've got some sort of bad habit.
Yeah.
So, and it just isn't about that, because the funny thing is the universe provides providers and people with an abundance mindset. And I'm so happy that you're part of the community, and I love what you do and who you are. And thank you for this opportunity to be on your platform, and hopefully, you know, some of what I said will resonate with a few people, either viewers or listeners, who might make a decision that's going to help either serve them or someone they care about or love who's dealing with a dire health challenge that's come about. Because at some point in time, just statistically speaking, it's going to affect either us or someone like us.
Yep.
And that'll never happen to me. Is I got to chant that. I always thought I'd be the last one to fall. And guess what, man? I got to have a Mack truck slam me right in the forehead one day. So
yeah, sure.
But, you know, it's a great gift in the end. It's a great teacher.
Absolutely. Well, again, thank you very much. Best-selling author, all-around great guy here in the universe, Mike Koenigs. Really appreciate you coming on the show. For those of you on the listeners that haven't already been, go to our Facebook page at healthcare, or facebook.com/healthcare elsewhere, so that you can get involved with the discussion. We're always looking for new people that we can discuss this with and talk to and interview. And again, thank you all very much, and we will talk to you soon. Bye, Mike.
Bye-bye.